You all know me. My name is. Okay. So, my name is Bosse Tonya Jacobs, as you can see. And by the special grace of God, I'm a registered nurse midwife. So, today I'm going to be taking you on first aid, basic first aid training. You see, when we hear first aid, I think one thing that comes to mind is like an accident scene, right? Yeah. But there are also some little home or house accidents, yeah, that we encounter in our various homes, apart from homes, even especially with kids. Yeah, our kids are always very active, and at times you see them play with objects that are actually dangerous to them. Yeah, so at times you might not even know. Before you know, you might just end up seeing a child bleed, like my little boy. In fact, that incident happened right in my presence. Right in my presence. I thought he was messing up the bathroom, and then I got in to just see what he was doing. But then because he was scared I was going to hit him, he jumped from the bathtub he was standing on and bumped his face on the toilet seat. And then his face just tore open and started bleeding. You see, if with the depth of the injury, if I had taken him to the hospital, I think they would have sutured and all that. But with my little knowledge, I was able to control the bleeding and then started treating. And by God's grace, it's just a little scar. So what I'm trying to say is it doesn't have to be like a big accident scene. There's just some things that normally happens at home. So, yeah, please, the first slide, please. So first aid is defined as the initial and immediate treatment or assistance given to an injured or sick person before the arrival of a professional health personnel or movement to the hospital. Yeah? The immediate treatment or initial, something you do immediately to save a situation is what you call first aid. You just do immediately before professional help comes, okay? Yeah, and then a first aider is a person that is trained to take care of individuals involved in an emergency. So you simply put, a first aider is trained to carry out the act of first aid. You get it? Yes. So please, can we go quickly? So there are a few aims or importance of first aid. A few aims. Firstly is to preserve life. Is to preserve life. The idea of carrying out that initial treatment, the idea of carrying out initial treatment is to ensure that this person's life will be saved afterwards, because there are some, if you don't do immediately, the person might just die. You get? Secondly is to prevent deterioration so that the condition doesn't get worse. You get it? That condition, if you don't handle immediately, might go worse. So the idea is also to prevent it from getting worse. And thirdly is to promote recovery. Because if you give immediate treatment, the recovery process will be faster. Yeah. So please, the next slide. And then there are 4 principles of first aid. You say you must stay calm first. Do not take risk for yourself, the injured person, or the witness. You must not take risk. You must, before you offer a first aid treatment, you must ensure that the environment, the place is safe, both for you and the victim. You get? So let's assume like a fire incident, yeah? What you must do first is to move the person away to safety. But then if it's not safe enough for you to also go in, don't take risks. Don't put your life in danger. Don't put your life, leave it for the firefighters to come and do first and whatever. Or if it's an accident scene that's in the middle of the road and there are trucks and whatever moving up and down, it's also not safe. If you notice these paramedics, when they come around, they first make a barricade. You get? The idea of the barricade is to ensure safety of that environment before they carry out whatever action they want to carry out. So please, let's go forward. Okay, yeah, sorry, please. The second step, yeah, they say manage the situation to give safe access to the person. That's the essence of the barricade I just mentioned. You give safe access to the person. The safe access is because you are not the health professional, and they may probably need to move this person to the hospital. So while you are managing, you expect that paramedics and whatever are coming, and they should also have a safe access. You get it now? Yeah, and then they say manage the patient in line with the current first aid guidance. There are current first aid guidance as per ensuring safety of the environment, taking the person to a safe place, and all that and all that. Then they do these steps, do things step by step. Do things step by step in order. Don't be confused. Don't be in a panic, and then you begin to do what you're supposed to do first. You are doing it last, or what you should do last, you do it first. You get now? Please, the next one. Then the role of a first aider, they say maintaining the airway of an unconscious person by placing them in a recovery position. Usually when you see an unconscious person, their mouth or whatever is always locked, kind of closed. But when you are supposed to, the recovery position is placing them on a flat surface, yeah, and then tilting their head backwards. The idea of tilting the head backwards is to open their airways. If the head is not tilted backwards, the tongue occludes the airway, and they might not taking air as much as they should. You get? So the recovery position is putting on a flat surface with the jaw tilted to keep the mouth open. And then perform CPR or using an automated external defibrillator and other equipment. We'll do CPR later. Using automated external defibrillator and chest-to-chest compression is not for us. It's only meant for health professionals. You must be trained to do it. So we'll only do CPR later, then apply pressure to stop internal bleeding, and then supporting an injured limb. We'll also treat all that later. Please, can we go forward? Next slide, please. So this is now a different of how to stop bleeding. How to stop bleeding. Bleeding refers to the process of blood escaping from blood vessels due to injury or other medical condition. Bleeding can be both internal and external. The external bleeding is the one you see with your visible eyes. While for the external ones, you only know by a few symptoms, some symptoms that the person presents with, okay? Let me give you an instance. I saw some persons, I don't know, this is their funeral thing back home in Nigeria. So at times, some of them celebrate the dead like so much. And then this guy was riding a bike and somehow fell and bumped his head on the pavement, those pavements along the road. And then also stood up. They were laughing at him, his friends. He stood up immediately and was also acting like the strong guy that he was. But then, in a few minutes, slumped. So obviously, he had an internal injury. And then before he got to the hospital, he died. I actually brought him to my hospital. He died. So they were, according to the story, the person they were celebrating at the dead, whatever, was supposed to be his grandmom. So I think they were almost buried along at the same time. You get the thing. So internal bleeding is even more dangerous than the external one. You get? Yeah, so signs and symptoms of bleeding, you see a visible wound, like there's a cut. Yeah, and then pain from the skin surface, loss of normal function at the site of injury. Of course, when you have an injury, you have a cut, you will not want to use that place at the particular time. Then pale, cold, and clammy skin. Yeah? Pale, as in you see this particular part kind of becomes flushed, of course, because of a broken, there's a broken injury, a broken skin, and then gets flushed, and then cold and clammy because there's loss of blood. It gets cold, you get? And then fast heart rate is also a sign because you are losing blood, and the heart is also attempting to meet up with the one that it has to also go around. Yeah, apart from that, when there's a cut, there's supposed to be blood coagulation, blood clotting. So at that time, the white blood cells is supposed to go to that part that there's an injury to clot it and all that. And that way, the heart is also beating fast to meet up with that action. That's the essence of the fast heart rate. There's also chest pain, dizziness or lightheadedness, and loss of consciousness. The loss of consciousness comes last. That's if there is a profuse bleeding that you could not control. Yeah? So the next, they say, before you try to stop bleeding, you must wash your hands. Before you try to stop it, you must wash your hands. You must put on gloves if there is any. Otherwise, you can use a plastic as a last resort. You can use a plastic because universal precaution says that you don't touch any body fluid except it's proven otherwise because it can be infected. You are not also sure that your palm or your hand or whatever body part you are using to stop this bleeding is free from a cut. Yeah, so you may touch with those bare hands, but then you can only also use your bare hands if it's a last resort. If there's no plastic or hand glove or anything, you are trying to save a life here, for crying out loud. So you can use your bare hands. Next step, please. To stop the bleeding, firstly, they say rinse off the wound with water so you can see it clearly, at least to see the size. When somebody is bleeding, you can't tell the size of the injury or the cut. You can't also see how deep it is. Until you wash off completely, you can rinse off with water to see the size. Then place a piece of sterile gauze or a clean cloth over the entire wound. We know what a gauze is, right? Yeah, that's white, whatever that is like a net. It has openings, yeah, that they usually use in the hospital for wound dressing. That's a gauze. Then you can place it over, not a small piece. It has to be big enough to absorb blood, yeah? Then if you can raise the bleeding part above the level of the child's heart, do not apply a tourniquet. Let's assume is the hand or the leg or whatever. You can raise it above the child. If the child is lying, you can raise it above, yeah? Or the limb also. That way, rather than blood going, because our blood flows both downwards and upwards, but if you raise it up, it then helps to control the pressure downwards, especially towards the direction, yeah. Then, using the palm of your hand on the gauze or cloth, apply steady, direct pressure to the wound for 5 minutes. Steady, direct. Steady. You don't just put and take out your hands. For 5 minutes, hold still for 5 minutes. The idea is also to give room for the clotting factors to clot and hold the bleeding, and also to compress that broken blood vessel. You want to close it to compress the broken blood vessel, yeah? And then, sorry, please go back. I'm not done with if blood soaks through the gauze, do not remove it. If you remove it, you might end up reopening the blood vessel that you already closed. You get, and if you notice, I'm sure some of us at one point or the other had injury. But then when they place the dressing and you try to pull it out forcefully, it starts to bleed. You get it? So that's why they say you don't remove it. Even if it's soaked, leave it, then take another gauze and place it over it and keep applying your pressure. So yeah, this is our gauze for those of us that do not know what a gauze is. Okay? Yeah? So that's the gauze. So let's go to the next slide, please. Call immediate medical care for large cuts or tears. Call immediate medical for large cuts or tears. If you can't stop the bleeding after 5 minutes, after 5 minutes you cannot stop a bleeding, call for help. Call for help. At least God has blessed us with health professionals around here. So they'll know what to do at every point in time. If the child is in your care and you've tried to stop and nothing's, call for help. You can't clean out the dirt thoroughly or something else is stuck in the wound. If you cannot clean up, let's assume it's like a broken bottle, yeah? That is the cause of this bleeding or injury. At times, even when you try to clean, you might just notice that something is still there that has not gone out. Call for help, okay? Because the more you do it, the more it's going in and also causing more injury. The wound is on the child's face or neck. If it's on the child's face or on the neck, please call for help. Then the injury was caused by an animal or puncture wound, e.g. nail. A dog bites the child. It not be your own. It's not your kind of job. It's not something you can intervene. Call for help. And if it's also a puncture wound, you must also call for help because usually puncture wounds, like from a nail, is capable of causing tetanus. So you must call for bites from animals and all that. They must give antivenom. And then for the nail and all, they must give tetanus toxoid. Then the cut is more than ½ an inch long or appears to be deep. If it's deep or too wide, call for help because they have to suture it. Next slide, please. How to spot and handle choking. How to spot and handle choking is another topic. They say choking is when a foreign object partly or completely blocks the airway, making the child unable to breathe properly. In our throat or in our throat here, we have the trachea and the esophagus, right, Mama? We have, I feel. We have both the trachea and the esophagus. So the esophagus is meant for your food and water to go through, while the trachea is meant for air to go through. So you choke when your food or your water goes out from, or doesn't go into the esophagus, but rather goes, even if it's small, goes into the trachea. And then you find yourself coughing to let it out. It's not its way, it's not its root. Nobody where is supposed to pass with that. So that is why you choke. The idea of the choking and coughing is to let it out, okay? Yeah. And that is why they also say, you see this, the mucus or phlegm you cough out when you cough. It's okay to swallow it, yes, because it's no longer in the respiratory tract, but has now gone to the digestive tract, and then you can pull it out. It goes out, and it no longer has effect on you. You get? And that's why at times some persons conveniently get that stuff off their baby's nose, and it has no effect. Yeah. How do you spot a choking child? Difficulty in breathing, speaking, or coughing, then a red puffy nose. You see, at times they come, and even when you say, what is the matter, they can't speak because they are trying to get that thing off, and at the same time, also trying to breathe at the same time, so they find it difficult to breathe and speak. And then there are also signs of distress, and they may point to their throat or grasp their neck. Signs of distress, like at times bluish, their skin gets blue, yeah, turns blue because there's no oxygen, enough oxygen going, no proper oxygen in the circulation, and that's why. So then what to do? What do you do? If a child is choking, ask them, are you choking? Because somebody can cough. You can be coughing and the person is not necessarily choking. Yeah, I had an experience with then I was even in school of nursing when I saw this girl. I was just standing outside and then I saw her coughing. She was just opposite my house. She was coughing continuously, a dry cough, continuously. I was looking at her. At the time I thought she was joking and she was coughing. Later I assumed because it was getting dark, I thought maybe something flew into her throat and she's trying to get it out. She was also coughing continuously. Then she crossed over to my side and she was coughing. I noticed that's okay. At the time I saw she was struggling. She started struggling. I said, come, what is the problem? She was still coughing. And then I said, are you asthmatic? She said, yes. You get what I mean? So someone can be coughing and it's not necessarily choking. It can be something else. You get, yeah? Then you must ask if the person is choking. Then if they can breathe, speak or cough, then they might be able to clear their own throat. If they can do that, you can just keep saying, then cough it out. Keep trying, you get. But then if they can't, that is when you carry out these actions. You slap it out from the back. You see how they positioned the child. Yeah. You give them that video, right? Okay. You're supposed to see that maybe when two steps per se. Firstly, one, you can sit, yeah? I don't have a door to demonstrate it. Okay, let's see. Well. Okay, so give me a chair. Maybe.
Take it back, sir. Back.
Take it back.
Sir, take it back. Back. Okay.
So that step is slap it out. If coughing fails to work, if this child still cannot cough it out, you need to give 5 sharp back blows. To do this, help them to lean forward. You see, these ones are normally for smaller babies. Those other bigger ones, you really cannot adopt this position for them. So smaller babies, you see how the baby, I want to demonstrate the second picture now that says 5 times back blows. Yeah? Okay. See, the child must lean completely on the arm, yeah? On the arm with the 2 legs over like this for balance. Otherwise, this child can just slip off because you are supposed to tilt downwards while you hit. You are hitting with the pad of your arm, not just your palm, the pad. This is the pad. Yes, that's what you are hitting with. You get? Yes, so you slap deep and hard, okay? So while you do that, it's expected you do it 5 times. 3, 4, like this is what you do. 5, yeah? When you do 5 times, you are supposed to check the mouth of the child if the object is out, okay? So if it doesn't come out, you do it again. And then while you are doing, also I was going to observe for signs of unconscious, probably the child now begins to pass out. Then you prepare for a CPR. Otherwise, you can also put a call across if you are so confused and you don't know what to do. Yeah? And then the first picture says you position is on your arm. Sorry, your leg like this. This one is basically to support your arm. Because of course some babies are also big now. Yeah? And probably the weight of the child can't really stay on. You might just get tired. So it's also to support your arm, yeah? You place on your leg like this, and then you do the same thing, okay? Yeah. Please, the next slide, please. Then this one is for the kids that are a bit bigger. You squeeze it up. Hey. You squeeze, they say squeeze it out rather, squeeze it out. If back blows fail to clear the obstruction, give 5 abdominal thrusts. Of course, you know it's a child now. Oh yeah, now. No, but I can use, sorry? Okay, I should use it. No. She will cry because it's going to be a bit painful.
No, she won't cry.
Yes. No. You say she's...
Okay, Teacher Vivian.
Okay, let's use Teacher Vivian. Yeah? Let's use Teacher Vivian now to demonstrate this. Give me one mic for me. Okay, it's fine.
Man, not vomit. Wait.
No, you're not going to vomit. So usually, they say you must squat to the level of the child. You see now, she's almost taller than myself. So normally I'm supposed to go like new. Yeah, but now the same level, we are too short.
Stand.
Okay. The child is supposed to stand in front of you, and then you kneel to the level of the waist.
So
Yeah?
pretend that she's a child, she's kneeling.
Oh, yeah.
Okay. So when you kneel to the level of the waist, yeah, you make a fist with your dominant hand. They say your dominant, some persons are left-handed, while some are right-handed. So if your dominant hand is the right or the left, you must make a fist with this one first, yeah? And then you you are supposed to know where the position of your hand should be a little above the navel. We know our navel, right? Yes, a little above the navel, yeah? So you put your hand like this, yeah? And then you support. See, firstly, your arms must be underneath this person's armpits, yeah? Yes. While you do this, you must make this first. You support with this arm, and then you change your position like this with this support to make a firm, yeah? They say you must push. Sorry, Vivian. Yes, it must be sore. You see, the idea is to force this thing out so it will be sore.
Not to press up.
So you don't take out your hand until you get that 5 thrust, right? So you place like this, and then you reposition the hand like this to make a firm thrust. They say you must push in and up. So at the same time, you get 5 times. Inside and upwards. In and up. Yeah, sorry. So, yeah, to get it out. At times, you are forced to they might be forced to vomit, and then the stuff comes out. Then you also keep checking for that stuff, whatever, checking their mouth for it. Yeah? And then you must also ensure that you do not poke your hands into your mouth, because while you try to poke your hands, you might be pushing the thing farther, you get. Yeah, so next, please. If the blockage has not cleared, call for emergency. Yeah, repeat 5 back blows until help arrives, rechecking mouth each time. If they become unresponsive, at any point, prepare to start for a child CPR. Next, please. Burn or scald. How to treat a burn or scald. A burn is caused by dry heat, like your iron or your fire, yeah? While a scald is caused by wet heat. Water, your hot tea, your oil, yeah. Then, for a burn or scald, look for red skin and swelling, pain around the area of the burn, then blisters may also start to appear. Next one, please. What to do? You start cooling. Usually there's also an acronym for that, like the acronym is STOP. The acronym can also be STOP, You can they say start cooling the bone or scald as quickly as possible. Hold it under running water for at least 20 minutes. Running water, not cold water. Usually our running water is tepid. They see it as a tepid water. It's not so cold, neither is it hot. So you let it run for 20 minutes until the pain feels better. If no water is available, you can use canned drinks or milk. Yeah? Then remove any jewelry or clothing unless stuck to this bone before the area begins to swell. Removing clothing or jewelry is also reducing bone because assuming now I have a bone injury with this jewelry on, this thing might have gotten hot. So if you don't take it out, it will cause more injury, more problem. Then when the bone has cooled, cover the area loosely with cling film lengthways. With cling film lengthways. You know what cling film is? Yes. You see that, Mama, we get them now. If you, yes. Yeah. So that's our normal thing. We have it at home. We use it to wrap our food or anything. At times you put food in a plastic and you don't have a cover, use it to wrap it over. Yeah. Then what to do? Do not wrap the cling film around the bone as the area needs a space to swell. You don't wrap it around. You wrap it lengthwise. Lengthwise. Not around, because it needs a space to swell for blisters and all that. Then if the bone is on a foot or hand, you could use a clean plastic bag. Do not use ice creams or gels. They may cause damage and increase risk of infection. Monitor the child and do not break any blisters that may appear, as this may cause infection. Then monitor the child and seek medical advice if the bone appears minor. Let's go. Then strains. Strains are injuries to muscle due to overstretching, such as hamstring strain. Hamstring strain is a group of 3 muscles that run along the back of the thigh. Yeah? Overstretching of muscles is strain, while sprains involve a stretch or a partial tear or ligaments which connect to bones and tendons, such as the knees. Next one, please. Signs: pain in the joint or muscles, swelling or bruising, warmth and redness of the injured part, difficulty in moving the part. Normally, we see our kids busy jumping up and down. But at times, you just see one of them will just come limping and all that. You keep wondering, now this small thing make you they cry? It could be worse, or something serious might have happened, okay? Especially if the child keeps crying continuously, even after you've helped the child, then you must look further. What to do? Make sure the child stops activity right away. Then think RICE. RICE is an acronym for the first 48 hours. The arrow stands for rest. You must rest the injured part, let it stay still for a few minutes, and then wrap an ice pack for the eyes. Wrap an ice pack, that's ice, cold compress in a towel and place over the injured part immediately. Cold compress is meant to reduce blood flow to the part of injury when there's an injury. It's meant to constrict blood vessels and reduce blood flow to prevent further damage. Why? Warm compress promotes blood flow. So that thing we do when there's an injury, they say press on with hot water. At the time we do it, determines the healing process also. Because depending on the injury, you either do a cold compress first or a hot compress first, okay? Then compressions, they support the injured part with an elastic compression bandage for at least 20 minutes. 2 days, for 2 days. We get compression bandage. Okay. And then elevate the elevation, raise the injured part above the heart level to increase. Let me see. Yes, this is our compression bandage. It's stretchy. Yeah, it's stretchy. So they say you must use that. The idea of it is to keep it in place, to keep the injured limb or injured part in one place to prevent further damage or tearing. Yeah. Then, okay, next slide, please. Seek medical care if the child has severe pain when the injured part is touched or moved. Continued trouble bearing weight, like the child is finding difficult to use the particular part. Assuming it's a leg now, the child's leg, the child will not want to use it. If the child finds it difficult to put it on the ground or walk with it, then you must seek help. If there's an increased bruising, numbness or feeling of pains and needles, tingling sensation, we know what numbness is now. You see, for instance, you keep your feet or your leg at a particular spot for some time, and then when you try to move it, it feels numb, and then you try to tap. While you are tapping, there's this feeling that you get, like there's a pricking of needle. That's tingling sensation. Yeah, so if the child is feeling that, you must seek medical help. A limb that looks bent or mishapen, then signs of infection, which is warmth, redness, swelling, and pain, and then a strain or sprain that doesn't seem to improve. After 5 to 7 days, you must seek help. Next one, how to give CPR. CPR means cardiopulmonary resuscitation. The C in CPR simply means cardio, related to the heart. Yeah? While pulmonary is related to breathing, the respiration. Then you resuscitate something that is not functional now, right? Yeah, the normal English words. Next one, please. When do you need to prepare for CPR? When there is an obvious heart attack. You don't just do CPR for somebody that is breathing or is conscious. You're only just going to cause more harm than good. There must be an obvious heart attack or cardiac arrest. The person is unresponsive with no breathing and pulse in situations such as unconsciousness, cardiac arrest, choking, electrocution, drowning, drug overdose, or suffocation. Yeah? The next one, before giving hands-only CPR, we're doing hands-only CPR, like I said, because for you to do both the chest compression and mouth-to-mouth resuscitation and use of other equipment, you must be properly trained and certified to do it. Yeah, so actually for health professionals, including paramedics and all that. But for us, we just need the hands only. And they're also trying to preach it in schools because the kids also need to learn. At times when their mates are playing, I've had this, one of my cousins also died while he was just playing soccer ball. He slumped and that was it. But if they were able to help at that time, I'm sure he would have been able to make it, right? So they said before giving hand CPR, you must check to make sure the scene is safe, tap the person on the shoulder, and you must shout, "Are you okay?" If this person is able to respond, then the person does not need CPR. But if this person is unresponsive, then you must put a call across. For South Africa, it's 10111. America is 911, right? Then you must also know your emergency number wherever you find yourself. Yeah, because we are here today, we don't know where God is taking us tomorrow. Then if the person is not responsive, you begin the hands-only CPR. No, the video clip, let them watch. You know, send them. Okay, how to deliver hands only? Kneel beside the person. You must kneel. How this place is, well, I can use this surface because it's below my waistline. It has to be below. And on a hard surface. You can't do CPR on a mattress or something. No. You can't do it on a soft, so it has to be on a hard surface. This is hard, and you can also do it on the floor, normal floor, because you have to kneel beside this person. You place the palm of your, this is, how do I describe? But the way to know the right spot where you are going to put your palm is to just measure your palm from the armpit to the middle of the chest. Do you get that? From the person's armpit to the middle of the chest. Because your arm is supposed to be on the person's sternum. This is the bone, that's the breastbone. The medical name for the breastbone is sternum. So you place your hand there, and that is actually the location of the heart. So the idea of Hans Holy Superior is to stimulate this heart that has stopped working to work. You get it? Yeah, you want to stimulate it to work. So when you position your shoulders, then push hard and fast. Please, maybe say help me. I don't know with the mic. You give her. Ma, give you. No need. Okay. Okay, there's no shedding. Okay. So you just position from the armpit. This is the armpit now of this bunny, right? Yes. You must do position to the middle of the chest. You are also doing this with the pad of your palm, not just your arm. And when you do this, you position like this. You lock your fingers with the next palm. You have to lock it, yeah? You lock it and support it. Let me take this out. You support this, place it on your palm that is underneath. This one must be on top and support it with pressure. And then your hand must be straight while you are doing CPR, yeah? You don't do this. You get? No, your arms must not move. It must stay straight. You get? It must stay straight. You see what I'm doing? And then you do with this, not your hand. You must do this. You see? While you do, chest compression, you do 30. And you are expected to do up to 100 to 120 chest compressions in 1 minute. 1 minute. Yes. So it's expected that you count out loud while you are doing it. As you do the chest compression, you'll be counting along. 1, 2, 3, 4. You must be fast. And you count along to 30. Usually if you are doing the mouth-to-mouth resuscitation, after 30 chest compressions, you give 2 mouth breaths. You get 2 mouth breaths. But we are not doing that now. It's the hands only that we are learning today. There's supposed to be a video clip, but unfortunately, I don't know, did not get it. So you can even check your... Put your mouth. No, I can't do... No, we can't do mouth to mouth. We can't do mouth to mouth because there's usually a technique for that. And if you do it wrongly, you might over-oxygenate. Yeah, you might so. Yes. No, we don't need it. Yes. But before... Yes. Continue the chest. Yeah. Yes. Yes. But then before you start the chest compression, you must call or put a call across. Like we said, 911. So help must be on the way while you are doing that. Thank you so much.